Welcome back. In this video demonstration, I'm going to show you how to use the Signout routine to hand over a patient to another provider when you're done your shift. I'm going to go ahead and expand my tracker here, and you will see this patient here is highlighted in green. The button here that I'm showing you has my name showing that I am the signed up provider for this patient. I can go ahead and queue this patient up for sign out to prepare the patient to hand over to another provider. When I click on this button, it provides me with an option called Queue for Sign Out. I'm going to go ahead and select Queue for Sign Out for this patient. It is now going to ask me if I want to add any signers to this patient so as that they'll be able to continue on and document on this patient within the same emerge chart that we have already created. It will allow them to now be a signer on the chart so as that you can sign off the chart and they'll be able to continue on with documentation without having to start a whole new chart. If you know who the physician is going to be that you're going to be signing over these patients to, you would enter their name here. So for example, if I'm going to be sending this patient over to Dr. Smith when I leave shift, I'm going to select Dr. Smith as one of the signers. I'm going to hit save. You will now notice over here on this tab under sign outs, there's now 2 patients pending sign out. When I click on the sign out tracker, you will see this patient that I just put onto the sign out tracker for handover to Dr. Smith when he comes on shift. Here, I'm going to enter a comment about this patient. This patient has abdominal pain, right lower quadrant, past 3 days. White blood cell count is elevated, and CT scan is pending to rule out appendicitis. Please follow up after CT of the abdomen. Patient has had a dose of ceftriaxone. Okay, so I've left a sign out comment here so that when I hand the patient over to Dr. Smith, he will have some information about what I've done on the patient and what I'm waiting to have done so that he'll have a full picture of what he needs to do when he takes over the patient's care. The information will also show down here about what the most recent vitals are, what the current orders are on the patient, and any other information that might be important for handing over this care of the patient. All right, I am now logged on as Dr. Smith, as you can see here in the top left-hand corner. When Dr. Smith comes on to his shift, he's going to be able to accept the sign-outs that have been queued up for him and review the information related to that sign-out. This will be done usually with both physicians discussing the cases together, but it can be done by reviewing the sign-out tracker while they're doing this. Dr. Smith will pull up the sign-out tracker by going over to the More Lists to find the sign-out tracker. The sign-out tracker is right here. We're going to pull it up, and you're going to see the patients here that I have queued up for sign-out for him. If another provider has queued up some patients for sign-out as well, they will show up here as well. Here is the patient that we queued up for him to take over care. This patient, you will now see the note that I placed here is available to him, as well as of any of the information on vital signs and current orders. Now, Dr. Smith, once he has reviewed the sign out and we have discussed it together, he can now accept the sign out by pressing this button you see right here, Accept Sign Out. When he hits the button, he accepted the sign out, and the patient will now show up on his tracker and that he is now signed up to be the physician to take care of this patient. He will now be able to go on and continue documenting on this patient in the current chart that has already been created by the previous physician. When Dr. Smith now wants to document on this patient, he'll be able to use the same document or emerge chart that has already been started on the patient from the previous doctor who signed it over to him. However, it will be a shared copy in that all the information that Dr. Smith enters will be under his name, but the information from the previous doctor will be available and annotated that it was from that particular physician. For example, if I click on the documentation now, it brings up a copy of the template, and you will see that there is co-signers on here, being that Dr. Garnis had saw the patient initially and started documentation on this patient, but Dr. Smith is also now involved in the patient's care and will be documenting within the patient's template as well. You will be able to see exactly who documented what when the final output of the chart is done, therefore knowing what information was entered by Dr. Smith and what information was entered by Dr. Garnis. Another feature in WebED is the ability to take information from an outside physician or provider, such as a family doctor's office, when they want to send a patient to the emergency department for assessment. There is a routine called call-in reception that allows you to take this information down and put the patient onto an incoming tracker so that the patient's information will be available when they arrive to the department, and the provider who triages the patient will be able to look into the system and see why the patient was being sent down for assessment. To access this, you would select the call-in reception from the hamburger button, which is this button here with the three little lines in it. When I click on this button, I'm going to select Call-in Reception. The call-in reception is going to bring up a box that allows me to enter some information about the call that is coming in with patients that are going to be brought to the emergency department. I can quickly enter the name of the physician that is sending the patient. I can enter the patient's last name and their first name, their age, their sex, as well as what the stated complaint is. I can add some more comments to provide more information that the provider who's sending me the patient is giving me, such as how long they've been having the pain, radiation to the back, and nausea and diaphoresis. I can also put my own information into the comment box, such as when this patient arrives, please notify the emergency physician. This way, when the triage nurse pulls this up when the patient arrives, they'll see that my comment tells them that I want them to bring this patient directly in for them to see the physician. Okay, I'm going to hit save. And now this patient is put onto an incoming tracker and will wait there until which time is when the patient arrives. The triage nurse or provider will be able to pull up that patient on the tracker and review the information on what was provided to us about the patient being sent down to the department for assessment. You can access this incoming tracker by clicking on the down arrow and pulling up the incoming tracker. Here you will see that this is the patient that we just entered that is coming into the department for a provider to see. To review the information on the patient, you can click the hamburger button and go back into the call-in reception routine. Here you'll see the patient that is waiting to be registered when they arrive. When you click on them, you'll be able to now review the information that was entered by the physician in the department who accepted to take the patient. Thank you for watching.